is a pleasure to be here in this webinar. I am the head of infectious disease at the Hospital Germans Trias, which is a hospital north of Barcelona. And together with Lourdes Mateu, Lourdes Mateu coordinates in my team. She coordinates the largest long COVID unit in Spain. Reinfections are, as I said, associated with an increased risk of death, hospitalization, and sequelae in multiple organs in comparison with no reinfection. So, and this is data from the US Department of Veteran Affairs. Even if compared with no reinfection, individuals with reinfection had an increased risk of all-cause mortality, hospitalization, at least one sequelae. What you can see here is that the risks and excess burdens of these aspects decrease or attenuated over time, but remained evident even 6 months after reinfection. So this is not something that we can ignore. An additional study, in this case from the group at Oxford, Daniel Prieto Alhambra and his team, Dr. Kotska, using databases from primary care from the Denmark and Catalonia in this case, confirming that an increased risk of post-acute COVID-19 symptoms following reinfection. So this is something that is clearly there. Then, so the issue is, okay, what can we do? So we need to prevent reinfections as much as we can. Before at a population level, it's good to have adequate vaccine exposure. But then what do we do once we have long COVID? And as I said before, there are a number of treatments. So it's not true. We sometimes say there is no treatment for long COVID, and that's not true. There are a lot of things that can be done. However, currently there is no pharmacological treatment that has proven its effects. Although patients are trying many different things, because this is a situation where patients are desperate. Also, some clinicians are also want to help and want to provide help, but from our point of view, we should only use things that have been really tested in randomized clinical trials. And of course, randomized clinical trials take time. And that's why we do need to increase and make all the efforts to develop all these clinical trials as fast as we can. There are many different options. One option is, of course, antivirals, is using different types of antivirals. Another option is doing small molecule antivirals, but also monoclonal antibodies or other types of antivirals. Another options, another group of treatments that are being investigated are different anti-inflammatory drugs. Also different drugs to treat the thrombosis or platelet, problems. As well, there are trials on dysbiosis, trials on vagus nerve resynchronization, so on and so forth. So there are a number of different trials, and what we really need to do is to move as fast as possible on those trials. Thank you for listening.